Hi there, I'm James Wedell. I'm a semi-retired family physician working for the Department of Corrections the last 15 years. The most anguishing case that I could think of was actually, I've worked in several different places. I've worked in private practice, I've worked in community clinics, I even worked for a staff model HMO for a period of time before I just really was extremely disappointed with the level of healthcare they were engaged in. And I just remember one patient that had been diagnosed with metastatic cancer. He had a primary in his lung with metastases to his brain. He'd gotten radiotherapy, and the staff model was very interested in restricting care for their patients. They had one physician who was writing over it for restricting hospital care as much as possible. Patient presented to the physician. He presented in an emergency room with a excruciating headache, but no other neurological signs. And the physician who was in charge of the admissions said, "I'm sorry, you don't meet hospital criteria. You don't meet admission criteria for hospital." So he went home and promptly shot himself to death. That was the most disintegrating for-profit oriented system I had seen, where an egregious healthcare system, and I was living actually in Texas at the time. I just couldn't believe that kind of care went on. I moved over to another aspect of. I worked for another private physician group there in San Antonio, Texas. I'll never forget. I admitted one patient. I was on hospital backup. There was an indigent patient that came into the hospital. On my examination of him, I found a very erythematous throat with a very white, purulent discharge, and I asked him to get a HIV test. This is in the mid-90s. They went ahead and did that. It turned out it was positive, and the hospital immediately wanted to discharge him. Immediately, they shipped him over to the medical school in Texas, in San Antonio. That was the only hospital in town that would take an HIV patient. I guess those are two of the most outrageous things I've seen. But I'm not sure it directly pertained to a single payer, but I found those two of the most catastrophic and uncaring things, and I think I'm not sure when we're going to get single payer through, but I know that when we treat people equally, whether they have money or not, and we can utilize a financial mechanism which would ensure health care for all, we would not have these kinds of disparities. Thank you very much.